Hi there, my name is Dr. Mashhood Qazi. I'm one of the emergency medicine consultants and you're watching my YouTube channel. If you like the videos on this channel, please kindly subscribe to my YouTube channel. In this video, we're going to talk about a very important aspect of clinical exams or any OSCE exam or any face-to-face exam for that matter, which the candidates will be encountering during their professional life. The topic is non-verbal gestures or the body language, sometimes also called as human factors. It's very important to note that whenever a candidate enters an OSCE station or any face-to-face examination station, the first impression that they make in front of the examiners counts a lot. As it's normally said, the first impression is the best impression, so you have to do your utmost that your first impression is really the best impression towards the examiner. Of course, it's needless to say that along with the human factors on the non-verbal gestures, you must be fully prepared for the material of the OSCE station. That's needless to say. But let's just focus on the human factors, on the non-verbal gestures or the body language, which is very important. First and foremost, when you enter an OSCE exam or any face-to-face exam, you need to make an extra effort to look tidy and neat. Remember, it's a professional exam. The candidates are expected to act very professionally. For example, if you turn up to an OSCE exam with an unshaven beard or your hair is not combed properly, you won't look like a professional or a part. So it's very important you take extra care on the day of the exam that when you're going to the OSCE examinations, you are tidy enough, your hairs are groomed, your beard, if you have a beard, is groomed and tidy as well. Along with the grooming comes the clothing. If you're wearing scrubs, just make an extra effort the day before the exam or 2 days before the exam. Choose the best scrubs you have. They should be neat, they should be clean, and they should be ironed out very nicely so that you look very presentable when you enter an OSCE exam or any face-to-face examination station. If you don't choose to wear scrubs, that's absolutely fine. But the professional clothing you're going to choose to wear, for example, if it could be a coat or a tie, it needs to be, again, very clean, well ironed out, and you need to look tidy and you need to look professional. So that's the clothing and the grooming part. Now let's come to the important bits, the body posture. The reason body posture is important because it gives non-verbal clues or signals to both the patient as well as the examiner how confident you are during that station. For example, if I'm sitting crouched forward, so I might come across as being a very anxious candidate. Or if I'm sitting very straight, I might come across as very arrogant. So the best body posture, which is recommended, is a neutral position in which you're not straightened up, you're not bent forward, but you're somewhere in the middle in a very relaxed position. When you have a neutral body posture, it gives a very good signal to the patient as well as the examiner that you are confident in this station. The second thing is the tone of your voice. Now, if you are generally somebody who speaks very hard, a very high-pitched voice, then you need to try your best to bring it down a bit for the OSCE exam. Your tone needs to be soft, but it needs to be reassuring so that the patient and the examiner both are comfortable that you know your whatever you're talking about in that station, and you come across as a very confident and reassuring physician. So if you just imagine if your voice tone your speech tone is very high, that would just come across as being very rude. Or if your tone or pitch of the voice is very low, it might come across as inaudible, and you might be saying the right things, but the examiner or the patient might not be able to hear you out correctly. The next comes the hand gestures. I come across candidates time and time again who are in the habit of flying their hands right, left, and center in the middle of an OSCE examination. Now the best suggestion or advice would be to hold your hands in one position. If you are somebody who has the tendency of having the hands flying around, then one of the ways you can control them is touching the tip of the fingers together and putting them on your lap, so that they don't fly across while you're speaking, because that will again come across as very unprofessional. Last but not least is how you sit with your legs on the chair. Now, it's very important, your legs should not be wide apart, or they should not be crossed up on top on each other. The best position which is recommended or suggested is when your legs are shoulder width apart and firmly grounded on the floor when you're sitting down. That just brings across an image of a very professional physician or somebody who's very confident. So just to summarize, the first bit is just tidy up your hairs, groom your beard. If you're clean shaven, make sure you shave it properly. Wear a very clean, tidy, ironed out scrubs or shirt, coat or tie, whichever you prefer. Your body posture should be neutral. It shouldn't be straight upright. You shouldn't be bending forward. It should be right in the middle where you are in a very relaxed position. Your tone of the speech should be very soft and reassuring. Avoid using a very harsh or very low tone. Your hands should be close to each other. They should not be flying all across. And your legs ideally should be shoulder width apart, so that it comes across as a very professional image. I hope you enjoyed these tips. I will be uploading more videos, especially targeted to the candidates who are going to be going into the professional exams. If you have any questions or comments, please contact me on WhatsApp or mention the comments below, and I'll try my best to answer them as quickly as possible. Best of luck for your upcoming exams. If you like this video, please kindly subscribe to my YouTube channel.